Good afternoon, and welcome to the webinar. Today, we will be chatting with Dr. Peter Grinspoon. He is a primary care doctor at Massachusetts General Hospital, an instructor in medicine at Harvard Medical School, and has been a cannabis specialist for 25 years. Dr. Grinspoon is a popular speaker and is frequently featured in the national media on issues such as cannabis, addiction, and physician health. His private practice offers comprehensive cannabis coaching and education, as well as certification. Dr. Grinspoon is also certified as a health and life coach in order to further help people find their goals and follow their dreams. He offers comprehensive health and wellness coaching on a wide variety of issues for which he is uniquely qualified to help. His latest book, Seeing Through the Smoke, Cannabis, an Expert Doctor Untangles the Truth About Cannabis, is now available for purchase. With that, we welcome you, Dr. Grinspoon. How are you?
I'm great today. Thank you for having me. This is so much fun.
It is an honor and a pleasure. Let's dive in. Can you tell us how you became interested in cannabis and psychedelics and what inspired you to become an expert in this field?
Well, first of all, my brother Danny, when I was growing up, was fighting a losing battle with childhood leukemia. And my parents illegally bought him cannabis in the early 1970s, right? When Nixon was starting up his war on drugs. And I was like eight at the time, 8 years old. And my brother Danny, when he used cannabis, he was able to come down and play with his brothers, play guitar, hang out with us. When he didn't use cannabis because of the chemotherapy, I believe he was on cisplatin back then, he would just be alone in his room throwing up. It enabled him to eat and to maintain weight. And so, there's nothing more impactful than seeing the alleviation of suffering in a family member. So I was as a kid, I understood that it was a medicine, and that propelled me through a career in medicine. I was immune to all the nonsense that they unfortunately still teach us in medical school. They only teach us about the endocannabinoid system, the system, how cannabis works in 13% of medical schools. So that part A is that I had firsthand experience with how helpful it could be. And part B is that my dad was this legendary cannabis scholar. His name was Dr. Lester Grinspoon. He was a psychiatrist at Harvard his whole career. And in 1971, he wrote a book called Marijuana Reconsidered, calling for the legalization of cannabis. And he worked on it for the last half century of his life until he passed away a couple of years ago at the, old age of 92. And then furthermore, the last thing is, it's very complicated. We always had guests and luminaries and experts in our living room, like Carl Sagan and Allen Ginsberg. There was always a marijuana pipe burning. I was exposed to it. And I was just given a very, very different view of drugs than were taught at the DARE program. What I was taught was 100% opposite. And then when I was 13, my dad wrote a book called Psychedelic Drugs Reconsidered. He was he reevaluated the literature in 1979 and was calling from the rooftops for the investigation and use of psychedelics in psychiatry. And he got retaliated against for this by Harvard Medical School. They literally didn't promote him ever, despite being there for 50 years and 11 books and 180 scientific papers, because he was calling for the use of psychedelics. And, now, fortunately, times have changed. At my home institution at Mass General Hospital, we have a center for the investigation of psychedelic medicine. It's come full circle. But at the time in 1979, my dad, what he was saying was heretical. But I read his book when I was 13. I'm these sound great. I can't wait to try these. And, also going into medicine, I had a very different attitude and sort of belief system about all these drugs of misuse than what we're taught. So I started, from day one of medical school, I was a proponent.
Wow, thank you so much for sharing that. And I think that really calls to the change in society's attitudes over the past few years and decades. How do you think society's attitudes towards cannabis and psychedelics have changed? And more importantly, what do you think has been the drive of these changes?
Well, cannabis, when my dad wrote his book in 1971, 12% of Americans supported full legalization. And and now 69% do. So it went up about a point for each of the 50 years that he worked on it. I think that medical use really destigmatized it. You know, my dad would testify at all these cases, and, you know, the DEA would raid these growers co-ops and these buyers co-ops, and like bring this like dying cancer patient in front of the judge and like handcuffs. You know, the person would be like terminally ill, and the judge would be like, what the hell are you doing here? Get this guy back to the hospital. Who cares if he's using marijuana? So really the medical humanized the whole thing, and people just, and then the excesses of the war on drugs, the like militarized units barging into neighborhoods, and, you know, the damage that were done to, not just to families, but like whole generations, and whole neighborhoods were destroyed by the war on drugs. So I think people started understanding that we've been sold a bill of goods about marijuana. I mean, it certainly has its harms. Of course it does, but it also has its benefits. And regardless of whether you think it has harms and benefits like alcohol or tobacco, people shouldn't be arrested. I mean, the harms of involving people in the criminal justice system are so much graver than the harms of using cannabis. It doesn't make any sense. So I think society slowly started to shift, and then it sort of gained momentum. And it's a really interesting question why, for example, the medical community has been so much more accepting of psychedelics than they are of cannabis. You know, with cannabis, the psychiatrists have always been like, oh, golly, that's illegal. You can't use that. And with psychedelics, it's like, hey, man, let's do some acid and see if we could do some therapy and evolve your attitude and overcome your depression. And there's just been this amazing double standard. And I write a lot about my new book, Seeing Through the Smoke, about why the psychiatrists in the medical community are so much more accepting. There are different theories. One is that cannabis paved the way for psychedelics, and others that like psychedelics are more like a white drug as opposed to cannabis being a drug that like blacks use. So like there's more support for it. Another is just that, you know, as a good friend of mine who runs the MGH Center for Psychedelics said, you know, a lot of people think cannabis is like Valium, like it might help people, but it doesn't cure them, whereas psychedelics actually can be curative for like treatment-resistant depression, you know, so it's sort of in a different category. And it was really interesting, the different theories, but fortunately, people are very much in favor of at least the legal access to these treatments, which of course they should be not criminalized. I mean, that just harms people much more than the drugs do.
Mm-hmm. Let's dig in a bit deeper and maybe set the stage by inviting you to explain the different chemical components of cannabis and their effects on the human body and the mind.
Absolutely. As we said before, there's this whole neurotransmitter system called the endocannabinoid system. It's a very ancient transmitter system that we have. It's like 500 million years old. It goes like way before humans. Like all animals have an endocannabinoid system. And, you know, we have receptors for this in our brains and our bodies. And it controls a lot of really important things like memory, learning, feeding, appetite, temperature, reproduction, emotions. I mean, it really is very central. You know, it's sort of like the dopamine system or the epinephrine system, but like even more fundamental because it controls all these other systems. And because of the war on drugs, we're slow to learn about it. There hasn't been much research about it. So we're just learning about it now. It's very exciting to be learning about it. And it just happens that cannabis bootstraps onto the system or sort of hijacks it. Because again, humans have been using cannabis for like a large part of their journey, but maybe for the last 10,000 years. But the system's like 500 million years old. So the different components, cannabis is a very complicated plant. It has like 500 different molecules in it, which is why some strains make you like energetic and creative and want to go dancing, and other strains make you want to just melt into the sofa and eat ice cream and watch Rick and Morty or whatever you like to do when you're just relaxing. But it's a very complicated medicine. And the main component is THC, which gets people high, for better or for worse. Some medical patients don't like this. A lot of people love it recreationally. They've been using it for thousands of years because it helps them appreciate sex, music, art, nature. It makes them mindful, connect with other people in the same way that psychedelics do. I mean, cannabis is a mild psychedelic. So that is the THC, but there are many, many other components. For example, CBD is non-intoxicating. CBD, 1 in 3 Americans have tried CBD, and 1 in 7 Americans are using some kind of CBD product. It's really amazing how the popularity has just taken off. And, CBD is approved for treatment in these refractory childhood epilepsy syndromes, which is really amazing. It helps stop the seizures right away. But for most adults, use it for chronic pain, anxiety, insomnia. It helps with public speaking. Interestingly, there's more and more evidence that CBD helps people with different addictions, even to marijuana addiction or addiction to opiates. So, it really depends on what type of cannabis you're using. It can have a whole wide range of impacts and influences on you. The final thing is it affects everybody differently, because it's like in personalized medicine, we all interact with drugs differently. And then here you have a drug or medicine with 500 different components. It's going to affect people differently. So, when I start people on cannabis, medical cannabis, I have them journal, write down the dose, write down the effect. If something works well, you write it down. If something made you anxious, you write that down and try something else. So it's very complicated, which is what makes it so fun and interesting. I mean, the medical potential, the lifestyle potential too, but the medical potential is just mind-boggling. And we're just starting to learn about all the different ways in which it could help people.
So a follow-up to that would pertain to some of the nuance when it comes to the chemistry of cannabis. And classically, there have been pretty astute records looking at the differences between sativa and indica. But now, with more than 20 states approving cannabis for recreational use, we can see in dispensaries the further delineation of terpenes. So can you speak to what terpenes are and what their role
Absolutely. Terpenes are what give it its smell and its taste. Real connoisseurs of cannabis are really big on terpenes. But they also have medicinal value, like myrcene, which is in beer and hops, makes you sort of relaxed and sleepy, whereas like alpha pinene, which is what you get from like being in a pine forest, like, forest bathing, makes you more alert and wide awake and sort of engaged. And there are, dozens of different terpenes, which again, the different strains have different tastes, different flavors, different smells, but it's the combination of all the different cannabinoids, which are molecules that work on the endocannabinoid system, and the terpenes, which are all thought to be medicinal and psychoactive. The combination of all these things together is what gives each type of cannabis strain its unique effect on people. There is a lot of marketing BS too. I mean, to be honest, like you go into dispensary and all the different strains have a very eerily similar sounding description. You read them, it's kind of funny, and they're like, gives you a euphoric burst of creative energy followed by a calm, relaxing, full body high. I mean, all the descriptions are pretty similar. So, and even the word strains is outdated. There are so many of them, and sour diesel in San Francisco is totally different from sour diesel, for example, to pick a strain in Boston, and the different sour diesel strains in Boston are different. There's like there's no consistency. So we tend to call it more like chemovars. Like, what are the actual chemicals? How much THC, how much CBD, how much of the other so-called minor cannabinoids? There's THCV, which makes you not hungry, which helps control your blood sugar. There's CBG, which helps with muscle aches and anxiety. So there's so many chemicals, and then all the different terpenes. The more you learn about it, the more you can sort of predict what kind of effect you're going to get. And again, it's not just sour diesel or Northern Lights. You can really see the better the labeling is. And Massachusetts is pretty good. You can see exactly what's in your cannabis. And just sort of like people become connoisseurs of like craft beer, with cannabis is even a lot more interesting, because you see all these different molecules and you know how they're supposed to affect you. And then you can see if they actually affect you that way, medicinally or lifestyle wise. And it's the science that's just exploding. It makes it very interesting for the educated consumer.
Well said. Now, earlier you had alluded to some of the medical uses for cannabis, whether it's pertaining to end-of-life care or CBD in particular. And there's mounting evidence that psychedelics can be utilized to address entities within the mental health realm, from anxiety and addiction to depression and PTSD. In your opinion, what are some of the most promising medical uses for cannabis?
Well, I see this every day, and the obvious ones are insomnia. It's really hard to argue that, as a primary care doctor for a quarter century, what I do is I don't say, is this medication safe? I say, is this medication the least toxic that we could use compared to everything else? And, giving someone a sleeping pill, of course, like first you get them to exercise and not drink, like I do, 8 cups of coffee all day. And not watch a very stimulant, watch like Succession on TV right before going to bed with a bright screen. You do all the lifestyle things, but then some people need something to help them sleep. And what you can give them a benzodiazepine, which is addictive and affects your memory. Ambien's like a lethal weapon, or you can give them a little bit of like CBD, prominent cannabis, have them take a tincture under their tongue and drift off to sleep. The side effects are you feel happy, a little bit euphoria, and you feel relaxed. I mean, the really side effects people help you go to sleep. You're just relaxed and calm. Chronic pain is a huge one. I mean, what do we treat? Americans are getting older, portlier, their knees and their backs are giving out. Tens of millions of people have chronic pain. What are you going to give them? Tylenol doesn't do anything. Nobody wants to be on opiates. We've had like 100,000 overdose deaths from opiates, which is so tragic. Each in the last 12 months for year after year after year. And then the non-steroidals, people think that if it's over the counter, it's safe. But your non-steroidals like your Advil, your ibuprofen, your naproxen, your Aleve, your diclofenac, you can take them now and then. But if you take them like day after day after day, if they don't give you a heart attack or an ulcer, and like 10,000 people a year die from that every year, they slowly kill your kidneys. Like I see so many patients in their 50s, 60s, and 70s as a primary care doctor whose kidneys are just giving out because of all the non-steroidals they've taken. And I'm convinced that if you give someone for chronic pain, now cannabis is not good for like extremely severe pain. It's not that strong. If you break a bone or have like spinal surgery, you need opiates, or at least at first. But for the chronic pain that people suffer from day after day, you're a construction worker, you come home, you need something. Cannabis is arguably a much safer and gentle alternative than these non-steroidals. And again, with the other cannabinoids, you're not necessarily talking about like Cheech and Chong, like people being like stoned out of their minds. You're talking about taking a little bit of a tincture under your tongue, which is mostly CBD, a little bit of CBD, a little bit of THC in it, and it just dulls the pain. It doesn't make it go away completely, but it also takes away your anxiety about the pain, and it makes the pain not bother you as much. People say, I'm aware of the pain, but I don't care. I was out, I went out for a walk. So I would say chronic pain, insomnia, anxiety, and obviously nausea and vomiting from chemotherapy are the most common indications. But certainly it's people with irritable bowel syndrome love it. People with colitis, veterans. It's hard to find a veteran with PTSD that won't argue that cannabis is like the only thing that helped them, and all the psychiatric meds they're given like just don't work. So there, fibromyalgia is very difficult to treat. Cannabis is spectacular for that. So it's, it just comes down to the fact that it's such a complicated system, the endocannabinoid system, that affects so many different of our bodily functions. This is why doctors who haven't studied the endocannabinoid system, it sounds fantastical that cannabis can treat and alleviate so many different conditions. But when you think of how many systems are regulated and run by the endocannabinoid system, it's truly amazing the wide variety of symptoms that I could alleviate with my patients with medicinal cannabis.
Now that we have covered some of the promises, I think it would be prudent to invoke potentially some of the perils. Can you speak to the potential risks associated with using cannabis and psychedelics, particularly in terms of addiction and mental health?
No, absolutely. I mean, our government has lied about cannabis for so long. And the problem, a lot of cannabis proponents will reflexively dismiss any new study of harm as like, oh, this is just government propaganda again. And like, you just can't dismiss the studies. There are harms of cannabis. You have to be, any user of any substance should want to know about the harms as much as they should want to know about the benefits if they could use it safely. So certain populations shouldn't use cannabis. I don't recommend it for pregnant or breastfeeding women, except in very special circumstances. If you very, very serious nausea and vomiting and you're in the hospital to control your hyperemesis, gravidarum caused, it's hard to argue that a little bit of cannabis is more dangerous than the Thorazine, the Haldol, the ondansetron, the lorazepam, all the other stuff we use to stop them from throwing up. So again, if cannabis is the less toxic alternative, I'm completely in favor of it. But generally speaking, I don't recommend it in pregnancy and breastfeeding. It's thought to be detrimental to the maturation of the teenage brain. So for teenagers, we say, just say, wait. We don't try to scare them to death with like the DARE program, like we did back then. Nobody believed it, and it actually increased drug use. But I believe in being honest and open with teenagers, and most teenagers don't want to harm themselves if you explain it to them. They're geared for adventure, so they might try it, but you just have to explain to them that it harms your brain. Wait until you're 18, because a lot of the damage is for kids before 16. So teens, pregnant women, breastfeeding, we have to be very careful before driving. It's not as dangerous as alcohol, but it's more dangerous than driving, completely clear-headed, and it's unethical. You could end up mowing into a family with kids. So driving is an important one. And then finally, you have to be very careful in someone who has a history or family history of psychosis. Cannabis does not cause schizophrenia, as a lot of the prohibitionists claim, and a lot of the psychiatrists claim. The rates of schizophrenia have been about 1% of the population, steady for the last 70 years worldwide. And the rates of cannabis use have gone up from like maybe 100,000 people in the 1950s because there were such draconian laws. Now there's like 400 million cannabis users worldwide, and the rates of schizophrenia are rock solid. So it certainly isn't causing schizophrenia. That's complete nonsense. However, if someone's predisposed to developing schizophrenia, like it's in their genes, cannabis can trigger it early, along with alcohol, tobacco, amphetamines. We treat people for ADHD with amphetamines, Ritalin, Adderall, and also steroids. There are several things. Cannabis is one of several that can trigger schizophrenia earlier. And that's a really big deal, because if you develop schizophrenia at age 21 instead of age 26, you're ill. You're not learning your adult skills. Your functioning turns out to be lower. So that is an absolute potential harm of cannabis. And then finally, people with psychosis, it can really destabilize them and make them worse. So there are definitely harms of cannabis. We definitely have to be very careful on how we use it. And just like we were talking about with the DARE program, how that didn't work, the US government has to be very honest about the harms as well as the benefits, or they lose credibility. I mean, honestly, as a primary care doctor, I've had so many patients say the weirdest things when I try to offer them COVID vaccines. Like, I don't want to become magnetic or be part of the 5G network. But then I've had cannabis advocates say, well, the government was lying to me about cannabis all along, which is true. So why should I believe them about a COVID vaccine? And I have to explain it's a different era in history, and it's different people in the government. And yes, the COVID vaccine saves lives, but like once you lose credibility, like as the government, or as a lot of the psychiatrists have done in cannabis, nobody really believes them about it. Or with the DARE program, it's very hard to regain credibility again. So like it's very simple. Listen to patients, as my dad used to say, like in the absence of studies, we do something very radical that doctors have been doing for thousands of years. We actually listen to our patients and be honest and clear and non-judgmental in your communication. It's really that simple.
That is quite a comprehensive reply and well received. I would like to challenge you to dive a little bit deeper, or maybe even elaborate further, specifically as it pertains to psychedelics. As you did invoke pregnancy and breastfeeding mothers, there are certain cultures that encourage the use of, say, ayahuasca in the Amazon, despite being pregnant or breastfeeding. And similarly, in parts of the United States and in Mexico, with mescaline in the peyote cactus. Of course, that has spiritual and cultural context. And one could make the case that there aren't randomized, double-blinded clinical trials to look at the safety. How do you perceive that paradigm?
Well, it's very complicated because, as you know, we're not allowed to test things on pregnant women, which is good. It's unethical. We can't like take 1,000 pregnant women and give them acid, and 1,000 other pregnant women and give them a placebo, and then see if there are birth defects or pregnancy complications. So the studies we have are sort of inferential. There have been so many studies, and this is part of the problem with the credibility of like the government and the psychiatrists in this issue. They take these studies and they're like, aha, cannabis causes all these harms to the offspring. But then, you know, the people that they pick are also suffering using other drugs and tobacco, and they're impoverished. So of course they're going to have worse outcomes, which is really awful. I work in a inner city clinic as a primary care doctor in my other hat. Like, of course, people who don't have good nutrition and prenatal care are going to have worse outcomes. And for 50 years, the government's been like, aha, cannabis is associated with small birth weight and lower IQ and whatever, 5 limbs falling off the minute you're born. And nobody believes them. But so the problem is the hyperbole, but the problem is also it's unethical to study. You know, as my wife said, like, you know, everybody says don't use cannabis. Don't you, when you're pregnant, don't use aspirin, don't use ibuprofen. Like, women who are pregnant are suffering. They have needs. They have to use something. So it all comes back to what is the least toxic thing we could use. But we don't actually know what's toxic and what's not toxic during pregnancy. I mean, you know, we know that alcohol causes fetal alcohol syndrome. That's true. The whole crack baby thing was ginned up. There's no such thing as a crack baby. It doesn't harm baby. Like, so we just don't know how harmful these things are. So when it comes to a psychedelic like ayahuasca, you've got to respect the indigenous wisdom and the indigenous treatment that's been going on for thousands of years. On the other hand, as a physician, as a primary care doctor, I've ingrained since like moment one to do no harm. So you have to give people honest advice, you know, and then if we haven't done the studies, I don't think there are studies showing harm, but it's very hard to prove a negative. So it's sort of like a ethical, like a moral decision, like a decision of values. Like, how important is it to use ayahuasca as part of your culture when you're pregnant, when we don't know if there's harm or not? Balancing the benefit to the culture, balancing the benefit to the mom, it's very difficult to say. Like, we know the harms of a lot of things, but we don't know the harms during pregnancy. So we're sort of operating in a vacuum of knowledge. So I think it's really just a judgment call and a question of like, which of your values is more important to you?
Mm. Yeah, and I do think that there is something to be said that the brain does have endocannabinoid receptors, and DMT as a naturally existing substance, of course, which the latter has a shorter half-life. And perhaps with time, we may be able to garner more information and identify some of the risks if they are evident. Dr. Grinspoon, can you
Can I just say one thing to that? You know,
please?
it's like we do have natural endocannabinoid receptors. So a lot of people, cannabis proponents say "Oh, cannabis is safe in pregnancy." We have the receptors. But the problem is when you're using them, you're using these huge doses. Like, if a doctor gives you steroids, we have natural steroids, cortisol. But when a doctor gives you steroids for like your sciatica or for your asthma, we're giving huge doses, like way higher than your body would produce to have an effect. And so the question is, what do these huge doses of DMT compared to what the body makes, or
Mhm.
cannabis compared to what the body makes, what effect do they have on the developing fetus or on a young child, where these systems are just evolving and developing? The concern is that it affects their evolution. As an adult, they're not dangerous. DMT doesn't harm anybody, you know, as long as it's used in a safe setting. It could be profoundly therapeutic, but the question, we just don't know what it does in pregnancy. So again, it's not an indictment of like the substance. It's just a very vulnerable time in the development when you're A, just a fetus, for example, developing the system, and B, the doses tend to be huge. So we just don't know what it does. So again, it's not anything against DMT or cannabis. It's just we don't know what it does during this very vulnerable time of development, which we know all these other drugs like ibuprofen or thalidomide we thought was safe, and then people were being born without limbs. So doctors have been burned so many times with these medications that we thought were safe in pregnancy, and they're not. And so there's just an attitude of like guilty until proven innocent. And that's sort of the medical culture. And that certainly could clash with the like a different culture that's had the use of these psychoactive agents as part of religious ceremonies or like collective mental health for millennium. And so again, it just comes to these two different belief systems that are a little bit colliding.
Let's take that very astute medical assessment and carry it over to a medical legal scope. As you know, marijuana is a Schedule I drug, which suggests that it does not have any medicinal value, but yet the FDA has approved Marinol, a medication that activates the cannabinoid receptors. And more globally, can you comment on how you envision the future of both cannabis and psychedelics evolving in the legal and regulatory landscape?
Right. Well, that's an artifact of the drug war. That cannabis is still Schedule I with like no medical utility, which is obviously not true. Not only do we have Marinol, which is THC, that's all it is, synthetic THC, which is the main component of cannabis, but they've also approved Apellidex, which is for childhood epilepsy. So there's several medications, and in Europe there's Sativix, which is CBD and THC, a very common medication people use under the tongue. So clearly it has medical utility. Like tell the 400 million people that are using cannabis, like for chronic pain, that it doesn't have medical utility. And then the high abuse liability is nonsense too. As we just discussed, cannabis does have abuse liability, but it's like low to moderate. It's not high. And way less than alcohol. Why isn't alcohol Schedule I? Because all the people that write the rules use alcohol. It's so hypocritical. Cannabis is about as addictive as caffeine, which is, somewhat addictive. We're all addicted to our caffeine, but so this is going to change. Even Biden, who's like a dinosaur on cannabis, like an ancient dinosaur from like the early Paleolithic times, is still trying to reschedule cannabis because nobody wants it to be Schedule I. People who are against it want to schedule it. People who are in favor of it want to research it. I mean, everybody wants it to be more accessible for research. And B is like nonsense that it's like Schedule I, but it's legal now medically in more than 40 states. Like it just doesn't make any sense to have like the federal government saying it has no utility, medical utility, and like 40 states have it legal for medical use. It's completely incoherent. So I think we're going to get rid of that very soon. The question is whether they're going to try to reschedule it, sort of like is not Schedule II, which is like your Percocets, your Vicodins, or Schedule III, which is like your Valiums and your Ambiens. It's really a question of like how scheduled it's going to be. Now with psychedelics, it's really interesting. Rick Doblin says that is predicting, and so do like many friends of mine, that they're going to legalize probably first MDMA due to the wonderful work of MAPS, and then psilocybin for use in a therapeutic setting, which is spectacular. It never should have been illegal, A. B, they should have listened to my dad 40 years ago when he was talking about this. We could have saved like, at least of cannabis, like hundreds of millions of needless arrests just for cannabis possession. But the fact is, it is going to be acceptable. It is going to be legal, but A, there's going to be a huge shortage of psychedelic therapists. I'm very interested in this. So hopefully be one of those. But Rick Doblin saying we're going to need like 20,000 psychedelic therapists because, it's very therapist intensive, the whole process of like integration, preparation, during the trip, which takes hours and hours. But then B, who's going to pay for it? I mean, as a primary care doctor, these insurance companies won't even pay for like the normal medications that we're prescribing. They're like, oh, you're in Suboxone, you need a prior authorization. And then you have these patients that are like, I don't want to overdose. What do I do? And they're paging you at like 11 o'clock at night on a Friday night because the insurance company won't pay for their basic elemental medication. How are we going to get the insurance companies to pay for psychedelic therapy? And it can't just be another treatment for like rich, well-to-do people who are white. I mean, that would be a disaster. That would be like such a slap to all the people that have been fighting for decades to get it legal and to help people who are being persecuted for cannabis use and for psychedelic use. So we have to find a way to get it paid for. And then the third issue is, a lot of people are getting psychedelics legalized, city by city. For example, in Massachusetts, I work with them. I've helped them. And does it have to be in a medical setting? A lot of people think it should be like in nature somewhere. It shouldn't be like at Mass General, in an office, and then you leave and you're all feeling better than you're out dealing with traffic. Like a friend of mine who was addicted to alcohol, she went from 1 bottle of wine to 2 bottles of wine a night. And she went to Costa Rica and did an ayahuasca session, and she lost her cravings completely for alcohol. Not only that, she quit smoking. That wasn't even one of her goals. She just wanted to get her drinking under control. She didn't have a craving for cigarettes in 6 months. And very interestingly, after about 6 months on the dot, her cravings for alcohol started coming back and she started smoking again. So it doesn't fix you permanently, but we have nothing that can stop you from drinking for 6 months in our medical armamentarium of medications. But, so she was in Costa Rica at this beautiful resort. Is that a better environment? There's a raging debate over like, what should the context be? And the other question is, should people be allowed to use it outside of a medical setting? Is it safe enough? I think, of course, they should, as long as they're making an informed decision. They know the risks, they know the benefits. There's good evidence out there. There's good instructions. You're someone who's not tripping, who's with you, who can take care of you, who can call for help, who can calm you down. As long as you have a companion that's like guiding you, doesn't even have to be a therapist, but, they shouldn't be criminalized no matter what. But there is a very big debate about like, what is the right set and setting? And do you really need to like pay a psychiatrist and spend thousands of dollars and be in an office building? Shouldn't humans, every society throughout human history has altered their consciousness, and it's so arbitrary how we pick the good drugs versus the bad drugs. Like caffeine's good, alcohol is good, cannabis and psychedelics have been bad. That makes no sense. Like as a physician, I'm allowed to give you Percocet, oxycodone, yet heroin, which is like the teeniest little medical chemical difference from the oxycodone, which I prescribe all the time, gets you in prison. It makes no sense. So we need to decriminalize them, but I think there's still a lot of work until like, a lot of people can make a good argument. It shouldn't necessarily be like a cannabis dispensary where anybody can just walk in and buy it. I mean, taking acid is a really big deal. You really want like that to be sold as a commodity and like upsold by the bud tender. Try this 300 microgram cookie of LSD. So there have to be guardrails, but the guardrails don't have to be criminalization. So that was sort of a long and rambling answer to your excellent and well-focused question, but it's going to be really interesting to see how this all evolves. And there are a lot of really, really complicated issues about what is safe, but what should people be free and allowed to do on their own without getting in trouble with the criminal justice system.
Wow. There were many brilliant points that you just brought up there that I'd like to unpack a bit. You brought up MAPS and Rick Doblin, noting that he is confident and hopeful that MDMA will be FDA approved for a PTSD indication. This is coming off of the heels of Australia becoming the first country to recognize MDMA and psilocybin as medicines for PTSD and depression, respectively, under the guidance of a licensed physician. And in your response, I am hearing that there is both this desire to decriminalize and minimize any legal action taken against those who are seeking psychedelic experiences. My concern is that with all of the progress that we've made over the past several years, that we do not want to repeat some of the errors of the past. In the 70s, when fellow Harvard academic Timothy Leary and Richard Alpert allowed for LSD to leak into the masses, you bring up set and setting being a very crucial component that, unlike any other therapeutic, will really affect the type of experience that the person who imbibes these substances encounters. So how do you balance that and mitigate the risk of unwinding progress by respecting the expertise that a licensed physician or mental health care provider can offer, while also respecting individual liberty and those who want to explore consciousness?
That's very complicated. I mean, first of all, people do drugs whether or not they're legal or illegal. They really do. They always have. I mean, it's not like LSD hasn't been used in the last 50 years just because it's illegal. Look at how many people use MDMA and mushroom. So the question is, like, if someone gets into trouble, do you want the police to be educated and trained in a harm reduction approach and calm the person down and put them in a quiet setting, or possibly take them to the hospital if they're having an awful experience? Or do you want the police to like arrest them? So we definitely need to get law enforcement, I think, completely out of the drug issue. I mean, literally, if opiates were legal, and not sold at 7-Eleven, but, dispensed by the government with, certain restrictions and sensible regulation, we wouldn't have 100,000 people a year dying of fentanyl overdoses. They're only dying because they have to get these drugs illegally and they're addicted. And instead of spending all this money on law enforcement, we could be spending it like they did in Portugal. They didn't just legalize drugs, they transitioned the funding from arresting people and incarcerating them to jobs and education and housing to give themselves people a path out of their misery and a path out of their addiction. And the fact is, people do have a right to experiment with their consciousness. And I believe that the more this can be open and in the public and not like hidden and secret, first of all, the supply is safer. Nobody gets bad acid if it's legal. And second of all, people can get help if they're having a hard time. So given that people are going to use drugs anyways, why not have it be out in the open, have supportive people monitoring it? And then finally, education is critical. Nobody wants to have a bad trip. Believe me, I've been there, done that. Plenty of experience doing psychedelics. Nobody wants to have a bad experience. So as long as you educate people about the right dose and they have a safe product and, a very safe, calm, relaxing place to do it, they could do it with someone, again, who's not using drugs, so get help if there's any problem. There's really, I'm a huge believer that people are going to do something anyways. Why criminalize it? And then people have the option to use it on their own, sort of informally, in the woods, hiking with friends. Like I've had many great experiences in my youth on mushrooms, like just having the most spectacular experience out in nature. Or they can go to a hospital and have very intensive treatment. They could have, which I'm hugely in favor of, if someone's going to pay for it. Again, it can't be another treatment for like the white and the wealthy. Well, our society doesn't need that. It just further, polarizes it if it's not distributed equally. And, people can go and get the integration and then have supervised treatment with a psychiatrist and several therapists and then have the reintegration. That's absolutely wonderful and spectacular. Some people are very against the medical model, and or they just don't think psychedelics, something that's spiritual and a mystical experience they don't necessarily want to have at MGH. MGH is a great place to have your appendix out. I love MGH. I've been a doctor there for decades, but you don't necessarily want to have your mystical experience with your true inner self and your dissolution of your ego, like in a hospital. You might want to have it like on the beach or on a mountain or quietly in the woods with some friends. So I just think it should be an option for people, and we could make it safer with sensible regulation and with education. But the necessary but not sufficient is getting law enforcement out of it, like completely. I hate to keep beating that drum, but it's like ruining so many lives. That's what's giving people a bad trip. A, with law enforcement, you don't have a safe supply. And B, people are afraid and in fear, which set and setting. Norman Zinberg is the one who wrote the book and came up with set and setting. He was like a fixture of my childhood. He was one of the people my dad was hanging out with. Like, believe me, that was beaten into me since like, the amniotic sac. I mean, before birth, it's been beaten into me, set and setting. But, people need to be able to ask for help and to be open about these things. I mean, a lot of the badness comes from the criminalization, not from the drugs themselves.
As you speak, I cannot help but to struggle to reconcile that there still is judgment and taboo in this space dating back to Nixon's war on drugs. And as an articulate and erudite physician as yourself, how did you become so comfortable speaking about your own personal experiences with the knowledge that this group of restricted therapeutics remains illegal in some sense? And to follow that up, it perhaps speaks to the evolving change in society's attitudes. And what do you attribute those changes to?
Well, first of all, it's really unfair that doctors aren't allowed to speak their minds, especially on complex and heretical topics like, hey, maybe some drug use is good. Like I wrote a chapter in my new book, Seeing Through the Smoke, called Do Be No Harm, about how the doctors were on just like the wrong side of the war on drugs. And there was no separation between what the medical establishment thought about cannabis and psychedelics and what the US government thought, which was total nonsense. And like, if my dad could think for himself on these issues, why couldn't other doctors do that? So B, I'm 15 years of recovery from this vicious addiction to prescription opiates. That's what my first book was about. I lost everything, my medical license, my marriage, like it was awful. And then I gained it all back by becoming really healthy and focusing on my recovery. And, you know, I'm sort of a big believer like Cali sober. Like, I don't think you can't use like cannabis and other drugs. You just can't really use your drug of choice at the happy time of your life, when the drug is filling a void of whatever trauma or all your other needs aren't getting met. So there's a vacuum that the drugs can fill in. So I'm not one of these Alcoholics Anonymous, you have to stay sober for life. You just have to stay healthy, not necessarily off every single drug. I drink caffeine. You've seen me guzzling caffeine on the show. Like if you're a strict, you know, Alcoholics Anonymous person, a drug is a drug is a drug. But so I've lost everything. So, and I've realized that like doctors have an obligation to speak their mind and to tell the truth. And they've just been on the wrong side of the war on drugs. And now doctors are coming around on cannabis and on psychedelics. They're coming around much more rapidly on psychedelics than on cannabis for reasons we discussed earlier in the show. But the fact is, we need to be able to speak our minds. We harm patients when we just parrot the party line. And there's been this awful war on drugs, which has been a war on people, mostly a war on Black and brown people. And doctors have no role in participating in that. So I've already been in trouble. And like, you know, honestly, it's more important to tell the truth than to worry about getting in trouble. And I really think doctors are people too. I mean, there are these great benefits from psychedelics. And there's no reason why a doctor can't who's suffering from addiction or who's suffering from treatment-resistant depression can't use psychedelic therapy. I mean, why wouldn't that? If anything, that should particularly be open to doctors. We're people too, and B, we have like this stress of a collapsing profession, and C, we deal with everybody else's problems. Like if anybody could use medical marijuana to have a little bit of relaxation at the end of the day, it's doctors. And why is this stuff heretical? Why is it taboo? When I was addicted to opiates, Suboxone wasn't given to doctors. Suboxone, like methadone, is the drug that saves lives when you're addicted to opiates. But it wasn't an option for doctors at all. It still is really rarely an option for doctors, even though there's a 50 to 80% reduction in overdose and death. And they say, we don't want to give it to doctors because it impairs doctors. But A, there's no evidence that impairs doctors. And B, you know, doctors are allowed to drink alcohol, to like use gabapentin, opiates, benzodiazepines, antihistamines, antidepressants, all these medications, Ambien, all these medications that are completely impairing. Why aren't doctors allowed to use the one drug that prevents overdoses and deaths? When we're addicted, when we have higher addiction rates, we have higher suicide rates, we're really suffering as a profession. So I think doctors should be like unshackled to say what they really think. They should be offered the same treatments, be it medical marijuana or psychedelics. And C, we have an obligation. Part of doing no harm, the most important part of doing no harm is telling the truth. And it's time doctors educated themselves about drugs of misuse or potential drugs of like vast benefit that have been stigmatized by our government and start talking about them.
I'm very grateful that you shared your background there, and I'm in awe of your ability to be so open and candid. So thank you for that. I would like to take the time to really expand on some of these hot button issues as it pertains specifically to psychedelics.
Didn't I tell you we can go on for days?
Hey, let's do it. Let's keep rocking and rolling. The first hot button issue that I would love to get your thoughts on are as it pertains to microdosing. There is this debate that microdosing psilocybin, for example, has its own merits and benefits, and that seems to be very different than the ego dissolution and really life-changing, perspective-altering experience that can be garnered from a large dose of the same substance. So how do you think about that discussion and that debate?
Well, I wrote a piece on it for Harvard Health on microdosing. And so I went pretty deep into the literature. And, you know, one problem with psychedelic research is that you can't really blind it. Like personally, I would know if you're talking about regular dosing, if I were given like a huge dose of LSD and like the walls are melting, or I was giving a placebo. So something like 98% of people in these studies guess, and the blinding falls apart. So it's very difficult for regular psychedelics to do these placebo-controlled blinded studies, because like, so obviously, if you've been given a huge dose of DMT and everything's dissolving, you've been giving a placebo and nothing happens. But with microdosing, you can do randomized controlled trials, because the whole point of microdosing is like a tenth or so of the regular dose. It's like sub-perceptual. So instead of like 100 micrograms of acid, you'd be given LSD, you'd be given like 10 micrograms. It'll be sub-therapeutic. So people don't always know if they're given it. So you could actually give half the people placebo. And a couple placebo-controlled studies haven't shown much of a sustained benefit. However, you talk to everybody who microdoses, or almost everybody, and they're like, yeah, it makes me feel happier, more relaxed, more creative. So there haven't been enough studies, so maybe we just haven't studied it enough. B, maybe we're not doing the right kind of studies, because, there's all kinds of ways to study things. And C, again, listening to patients, if it makes so many people feel happier, relaxed, more creative, more in tune with themselves, that's a good thing. Though at the same time, it is illegal to give people placebos. Doctors used to be able to give placebos. My dad was a psychiatrist, and when I was growing up, this woman was like freaking out in the airplane, and the pilots were like, should we land the plane? Is there a doctor on the plane? And my dad reluctantly raised his hand and stood up, and he sat down next to her and he gave her a pill. And he said, with his Harvard psychiatric voice, you're going to be fine. This pill is going to make you calm down and fall asleep, and you're going to be fine. And within 15 minutes, she said, thank you so much, and fell asleep. And they were able to go to their destination. She was grateful. And all my dad gave her was a sugar pill, which doctors used to be able to carry and give to patients legally as part of the ethos of the profession. Now it's illegal to do that. It's thought this is not informed consent. You're misleading the patient by giving them a placebo. So medically, ethically, we're not really allowed to give people placebo. So it is kind of a big deal whether the microdosing is a placebo or not. I mean, any pill you give to someone and you say, this is going to make you feel happier, more relaxed, and more creative, people are going to feel happier, more relaxed, and more creative. So I think we have to really find out whether microdosing works or not. At the same time, as long as people have a safe supply, again, it's not impairing. I think it's a very safe thing to do. So I don't think it's harming people. Again, like all drug use, the more legal it is, the safer it is, because the supply is legal. And if a person gets into trouble, they can ask for help without fear of repercussions. But that was a very long answer. But the jury is out as to whether microdosing with psychedelics works. Yet, most people who do it find a benefit. And it sort of makes sense theoretically that if a bigger dose on the serotonin receptors or whatever receptors, we're still figuring that out, makes you feel better, why wouldn't a smaller dose help? So I'm, enthusiastic about microdosing, but I'm still like intellectually honest about the fact that we haven't like definitively separated it from the placebo effect.
Very interesting. And a great segue to the next hot button issue, because a recent article came out to demonstrate that it is the intracellular serotonin, or 5-HT2A receptor, that is activated. We have work being done to demonstrate that psilocybin in particular may have anti-inflammatory properties. And also there's this ongoing discussion of neuroplasticity, neural rewiring, even at sub-therapeutic or sub-perceptual doses, I should say. There is this very, very rigorous discussion surrounding removing the trip of a psychedelic substance, taking respect of those endogenous properties of the medicine, where the other camp of this discussion is emphatically in support to underscore that it is the trip itself that allows for long-lasting, potentially sustainable change. Where do you stand on that debate?
Yeah, people really not viciously, very polemically disagree about that. On the one hand, it makes sense if it affects certain receptors. They might not be the exact receptors that cause the mystical experience, the trip. So why not refine these molecules? It would be a lot more pragmatic if we could treat treatment-resistant depression without having to hallucinate for 4 to 6 hours. Other people really feel that it's the ego dissolution, the trip, the profound insight that you get that is integral to the process of growing and changing. I would be astounded if they found that the trip weren't essential. I mean, in my experience of psychedelics, I've come away with such profound insight. Even cannabis gives you insight. Not all the insight. I mean, Carl Sagan's written a lot about this, the astronomer. In fact, I quote Carl Sagan a lot in my book, Seeing Through the Smoke, about the ways in which cannabis helped his creative process. Is really absolutely fascinating. This is literally the smartest person I've ever met in my life. And, so I think the trips are at least in my experience and in the hundreds of people I've spoken to and in all the books I've read. My dad wrote 2 books on psychedelics. One was the big one that got him in trouble, Psychedelic Drugs Reconsidered. The other was Psychedelic Reflections, about the ways in which their psychedelic experiences help people grow and change. I'm a big believer that the mystical experience and the trip are integral to the profound way in which we change. I mean, you're talking about these ruminative thoughts. I mean, part of it's the neuroplasticity, and you're having different parts of your brain communicate with each other that don't ordinarily communicate. So your brain is sort of discovering healthier pathways to deal with the stress and trauma and anxiety that you're struggling with. But part of it's just a new way of seeing the world. I mean, it's really, really interesting. The way I explain it to people is that think of a black and white TV in the 1950s. Then you think of a modern, huge, flat screen TV where it's so much more vivid. When you're walking in the woods, if you take mushrooms, it's going from one of those to the other. It's really, it profoundly expands your consciousness and your perception. And sure, they might come up with some drugs that alleviate depression or help alleviate it without the trip. SSRIs do that, and they work on the serotonin receptors. The psychedelics just work on a slightly different permutation of the similar serotonin receptors, as you alluded to before. Even if they fully work on the serotonin receptors, this whole field is in its infancy because of the war on drugs. We're just starting to restudy it. But I personally think that the mystical experience is critical. And that actually leads into another hot button issue, which is what I thought you were going to ask me about, which is do psychedelic therapists have to have experienced psychedelics to be effective and knowledgeable psychedelic therapists? All the psychedelic therapists who haven't think, of course you shouldn't have to. All the psychedelic therapists who have had these experiences think, of course you should. But, when they poll people about what do you want in a psychedelic therapist, it's not psychiatrist versus social worker versus shaman versus life coach. The only thing that polls number one is that people want someone who's had this experience, who understands what they're going through. I mean, and that really tells me that the mystical experience is integral because people find it so meaningful. And we're talking about dealing with and processing past trauma. Think of a veteran with PTSD, right? There's going to be no receptor that we tickle that's going to make the trauma go away. You have to work through it and process it. And that's what psychedelics help with. So I actually would be very skeptical of the idea that we're going to have psychedelics light without the trip that solve our problems. I mean, they might alleviate it. All this research into it might give us a whole new class of medications that does help with depression, but I don't think they're going to be as life-alteringly impactful as our current psychedelics are.
I tend to agree. Dr. Grinspoon, this conversation has been absolutely fascinating and enlightening. I do have one final question for you, and that is, what advice would you offer to individuals who are considering using cannabis or psychedelics for the first time, and what steps should they take to ensure a safe and positive experience?
Well, with cannabis, it's start low and go slow. The main way to get into trouble with cannabis is to take too big a dose. So I have people start with a tiny dose, and then they have worked them way up slowly over 2 to 3 weeks. I say, if we're going to make a mistake in the dose, we're going to make a mistake where you don't take enough, you're a little bored and disappointed, but we'll get there. If you take too much cannabis, nobody dies. It's not lethal, but you could really have an uncomfortable experience. You can get anxious. You could have panic, racing thoughts. So you want to just start low and go slow and take your time. You don't want to do it when you have to drive or you're responsible for elderly parents or little kids. You want to do it in a setting where it's calm and relaxing, and you're not and you can pay attention to yourself and to those around you. You're not in charge of anything. With psychedelics, it's very similar, but it's a little bit more of an investment. I mean, psychedelics, they're taking a psychedelic trip is like a really big deal, and it just lasts for hours, and it could be very frightening if you're in the wrong setting, and it could be this life-alteringly beautiful and wonderful experience if you get it right. So I would just say, educate yourself as much as possible. If you have a doctor that knows anything about this stuff, much better to talk to your doctor than not to talk to your doctor. And doctors are catching up. They're way behind the patients, particularly on cannabis, but they're catching up. And there's really, really good information out there, like at MAPS or all these other psychedelic support groups for people that want to do psychedelics. I mean, there's always the option of, when it becomes legal, there's going to be the option of doing it through the whole medicalized hospital setting, which the advantage of that, it's very safe, which is spectacular. The disadvantage is not legal yet, so you can't do it unless you're on a study, and everybody's so interested in this stuff. There's like the waiting list to get on studies is years. The other disadvantage is like, who knows who's going to pay for all the psychiatry and all the therapy. So there's all these things. So for an option now, if you're just going to do it, make sure you have a safe supply, make sure you're working with someone very knowledgeable, and make sure you're just in a safe setting where you're not going to be responsible for anything. Your phone or your beeper isn't going to go off and say you have this emergency to deal with, and make sure you're with someone who's not using psychedelics, who can guide you and calm you and spend time with you and make sure that everything's okay. And these are not lethal drugs, but they just need to be used with respect, with caution, and they need to be used responsibly.
Absolutely fantastic. I want to thank everybody listening and tuning in for your time and your interest. Special thanks to our host and sponsor of this webinar, Psychedelics Anonymous, a Web3 brand. And a special thanks to you, Dr. Grinspoon, physician at Massachusetts General Hospital and instructor in medicine at Harvard Medical School. His new book, Seeing Through the Smoke, Cannabis, an Expert Doctor Untangles the Truth About Cannabis, is out now and available for purchase. Thank you so much.
Thank you for the great questions and the great conversation.